Welcome to the Centers for Medicare and Medicaid Services module, the HIS, Section F, Preferences. This module will introduce learners to the HIS Section F, Preferences, which includes items F2000, CPR Preference, F2100, Other Life-Sustaining Treatment Preferences, F2200, Hospitalization Preferences, and F3000, Spiritual Existential Concerns. In this module, we are only going to focus on discussing specifications for individual measures. Although items in this section are also used to calculate the hospice composite measure, we will not cover the details of that measure in this series. For more information on the composite measure, we recommend you review the QM User's Manual, which can be found using the link on the resource slide. This is the third of 8 modules in the larger series, HIS Coding Guidance. Overall, this series is intended for users who are familiar with HIS coding and submission guidelines. For newer users, we recommend starting with the HIS manual and older trainings first. These modules will not cover all items in all sections. Learners may choose to listen to the entire series or may choose to listen to 1 or 2 modules that are of most interest to them, meaning the modules in this series can be watched independently or as a group. Included here on slide 2 is a list of acronyms that will be used in this presentation, listed in alphabetical order. After completion, learners will be able to state that the intent of the items in Section F are to capture the evidence of a discussion or attempted discussion about patient preferences, inclusive of CPR preference, other life-sustaining treatments, hospitalization, and spiritual existential concerns, and describe the quality measure calculations using HIS data. The items in Section F correspond to 3 quality measures: NQF 1641 Treatment Preferences, NQF 1647 Beliefs, Values Addressed, if desired by the patient, and NQF 3235 Hospice and Palliative Care Composite Process Measure, Comprehensive Assessment at Admission. Overall, items in Section F are intended to capture whether the hospice opened the door for a conversation about various patient preferences. Credit for the associated quality measures is not contingent on the patient engaging in a discussion or coming to a decision about what their stated preference is. Instead, the intent is for a hospice to attempt to engage in a discussion with the patient or responsible party or caregiver about certain preferences. Discussions can be initiated by any hospice staff member, and it is permissible to consider care processes documented in the clinical record that took place during pre-admission or educational informational visits. Preferences are best discussed with the patient, though it is permissible to have the discussion with a responsible party or caregiver, depending on the topic being discussed. Responsible party refers to the legally responsible or authorized individual, such as the healthcare power of attorney or legal guardian. The first item in Section F is F2000. F2000 is intended to capture evidence of a discussion or attempted discussion regarding a patient's CPR preference. Remember, this item is about opening the door for a conversation, so the discussion does not need to result in a decision. You would complete F2000B based on the first dated discussion or attempted discussion about CPR preferences. For this item, you may also consider discussions about CPR preferences that are documented in the clinical record that took place during pre-admission or educational visits. In these instances, you would use the date on which this discussion occurred for F2000B. For coding F2000 items, orders alone, completed DNR pulsed, and short answers such as DNR, DNI, or full code without documentation of a discussion are not sufficient to answer yes to F2000A. The next item in Section F is F2100. This item is intended to capture evidence of a discussion or attempted discussion about life-sustaining preferences other than CPR. There is no comprehensive list of life-sustaining treatments, but examples may include, but are not limited to, antibiotics, intravenous fluids, tube feeding, dialysis, ventilator support, and blood transfusions. Because there is no prescriptive list of other life-sustaining treatments, if you attempt to discuss any life-sustaining treatment other than CPR with the patient or responsible party, that is sufficient to answer 1, yes, or 2, yes but patient responsible party refused, to F2100A. Now let's talk about what counts as a discussion regarding hospitalization for the next item in Section F, item F2200. This is an item we get a lot of questions about on the help desk, and the most common question is, what counts as a discussion regarding hospitalization? Hospitalization preference does not refer to the patient's choice of a particular hospital, but rather if the patient has a preference of hospitalization as a care option. Thus, a conversation about whether the patient would prefer to be hospitalized or remain in their current location of care, should their needs change, would be considered a discussion about hospitalization for F2200. The fact that the patient is currently receiving care in the hospital does not indicate their preferences regarding hospitalization. Additionally, discussions about more intensive levels of hospice care, such as respite care and general inpatient care, do not count as a discussion regarding hospitalization. The last item in Section F is F3000. F3000 asks whether the patient and/or caregiver was asked about spiritual existential concerns. Again, it is intended to capture evidence of a discussion or an attempted discussion. Right off the bat, you'll notice one difference between F2000, F2200, and F3000. Whereas the earlier items in Section F refer to responsible party, F3000 refers to the caregiver. For the purposes of completing item F3000, caregiver does not have to be the legally authorized representative. This is different than other items in Section F, in which the responsible party refers to the legally responsible or authorized individual, such as the healthcare power of attorney or legal guardian. If the patient is unable to self-report for the purposes of F3000, it is ideal to speak to the person most knowledgeable of the patient's spiritual or existential concerns. Regarding how to answer F3000A, indicating an initial assessment was set up with the chaplain or that the patient does not wish to have a chaplain visit would alone be insufficient to say that the door was open for a conversation. Likewise, short statements about the patient's religious preference are alone insufficient documentation to answer yes to F3000A. Let's review the quality measures associated with HIS data collection for items in Section F. NQF 1641 is the percentage of patient stays with chart documentation that the hospice discussed or attempted to discuss preferences for life-sustaining treatments. To meet the numerator criteria for NQF 1641, the patient or responsible party should be asked about preference regarding use of cardiopulmonary resuscitation, hospitalization, or other life-sustaining treatments no more than 7 days prior to admission or within 5 days of the admission date. NQF 1647 is the percentage of patient stays with documentation of a discussion of spiritual, religious concerns or documentation that the patient caregiver did not want to discuss spiritual or religious concerns. To meet the numerator criteria for NQF 1647, the patient or responsible party should be asked about spiritual existential concerns no more than 7 days prior to admission or within 5 days of the admission date. While the series overall is intended for users who are familiar with HIS coding and submission guidelines, information regarding the Hospice Quality Reporting Program can be found by clicking the hyperlink on this resource slide. This resource slide also contains hyperlinks to specifics on the HIS Hospice Quality Measures, the QM User's Manual, and the HIS Manual V2 with the change table. The Hospice Quality Help Desk is available to assist with general questions about the Hospice Quality Reporting Program. This concludes the module Section F Preferences. This module focused on the items in Section F Preferences and included coding guidance, examples, and tips for all items in this section. This is the third of 8 modules in the series, Hospice Item Set Coding. The other modules in this training series are listed here, and we encourage you to view these training modules as well to understand more about HIS coding and learn how it may help you in your hospice. Thank you for viewing this presentation. The information presented was correct as of the date it was recorded. This presentation is not a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings.